Thank you so much, Dr. Gupta, for joining us today.
Yeah.
Do you mind just introducing yourself for our viewers?
Yes, hi, I'm Priyanka Gupta. I'm a urologic surgeon here at University of Michigan.
Excellent. So could you take me back to where your interest in medicine began?
Yeah, I think I probably became interested just at visits at my pediatrician's office and just sort of being interested in the practice of medicine. I think, like, I'm Indian by background, and I think like a lot of Indian kids, first generation growing up, our parents encourage us to think about medicine just because it's sort of a noble profession.
Or engineering.
Or engineering or being a lawyer. Yeah. So I actually initially didn't want to do medicine because I didn't want to be sort of typecasted into that role. But I was interested in it. And then in college, I decided to dual major in business and science because initially I was thinking I was going to do like healthcare economics or something on the business side of medicine. And while I was an undergrad, I had a few different experiences. I worked in healthcare administration, I worked in healthcare policy, and I think the thing I kept coming back to was that I was meeting all these people doing work in healthcare, but I felt like none of them had actually taken care of patients and were making policies for doctors. And I said, well, shouldn't we have more doctors that are maybe interested in these kinds of issues, but shouldn't people first maybe become a doctor and know about what it's like to actually practice medicine? So I think that was kind of, at the end of the day, I went through sort of my exploration and then said, I actually do like taking care of people, and so maybe I do want to go to medical school. So that was sort of then I said, okay, I'm going to apply to medical school.
Wow. Okay. Did you have any like mentors or other physicians in the family that sort of showed you what being a doctor was like?
No, actually, I actually, unlike many Indian families, like I didn't have really doctors that encouraged me. I had an uncle who's a physician, but we didn't spend too much time together. And on my mom's side of the family, actually, I was the first woman to get advanced education. Wow. My mom's family in India often the girls got married young and didn't go to college, and so it was I was sort of the first doctor in the family on her side.
Wow, amazing.
Yeah.
So what was medical school like? People often say it's like you're trying to drink out of a fire hydrant. So how do you sort of manage that insane amount of information that's coming at you?
Yeah, I think, so I'll be honest, the first year of medical school was really hard for me. I think like many people who go to medical school, I had done well in school, had good grades, worked hard, and I got to medical school and it was a lot of information. And I think for the first test I took, I failed, which I had never failed a test in my life. And that was despite studying. And I think what I realized was I had to study differently and I had to find different methods that worked for me. I went to the Mayo Clinic for med school, and so I went from a large undergraduate university to a very small medical school class, and was really fortunate to be with a lot of brilliant classmates. And so, I had to kind of look at how different people were studying and figure out the methods that worked for me. And so then after that first test, I kind of found my stride, but it was a challenge. It's a lot of information, and you have to figure out what's important for the test, but then later what's important for when you actually practice.
Right. And a lot of medical students, once they start, they sort of get this feeling of imposter syndrome. Like, did you feel that? Was that something that's realistic, or is that just out there?
Oh, I think it's definitely true. I definitely felt that way, especially like I said, failing my first test, I sort of was asking myself, am I in the right place? Is this the right field for me? I'd always thought I had done well in school, and then I was like, how could I not do well here initially? So yeah, it was definitely something that I struggled with in medical school, and as I'm sure we'll talk about, is also something that I think for many women in surgery is something that many of us struggle with too.
And so obviously a big part of medical school is finding mentors and networking with people. What is that process like? Because obviously medical school classes are smaller than what you'd find in undergrad.
Yeah, I was really fortunate to find a few different people. So I think our medical school did pair us with some faculty to help us initially when we first started. And through one of those meetings, I met a faculty member in the Department of Internal Medicine, and she and I really connected. And so I did a lot of research with her early on in my undergraduate time, and early medical school time. We're in medical school now. But she was a great mentor for me, and she really even though I didn't choose medicine as my specialty ultimately, she was a great mentor for me kind of throughout medical school. I would meet with her periodically and kind of talk about career decisions and take a look at what I was thinking and how to navigate that. The other person that I met that really helped me decide on urology, someone had suggested shadowing. And so this is actually something I always tell medical students is just go try to spend time in different places, especially in your first year, because you just never know what you'll like. I didn't know what a urologist was when I started medical school. I had no idea. And someone said, oh, if you're kind of interested in surgery, like you should just go check this out. So I happened to go to an operating room, and the chief resident that day, Dr. Krauser, who's actually here at Michigan at the VA now, she was at Mayo with me. She was the chief resident that day. I still remember kind of going into this case, and she said, do you want to make the incision? And I was like, me, and she handed me the knife and she let me make the skin incision. And that moment has really stuck with me. I left the operating room and I was like, this is the best day I've ever had, and so that kind of solidified that maybe surgery was where I should take a look. And then she and I had just a lot of synergy. She had been doing a lot of international work and working on some conditions for women, and that really resonated with me and sort of got me thinking about urology. And so really those, sometimes those chance meetings end up being someone who can be really influential for you. And she and I, she also mentored me kind of through the process, and have actually now she was at Minnesota when I was a resident. She's on faculty here, and we've been kind of friends throughout this whole time. So, it's been really kind of very lucky how you find people.
Right. And so obviously, like in medical school, you're trying to figure out what kind of doctor you want to be out in the real world. So, and that's why you have rotations, right? And how do you sort of go through rotations and figure out what specialty sort of speaks to you?
Yeah, so I think it's always a hard thing. And one of the things I tell students a lot is you have to figure out, you have to separate the person from what you're studying and seeing, because sometimes you meet people and meet doctors and you're like, I want to be just like this person. But maybe you want to be like them from the kind of person they are, the way they interact with their patients, but maybe the actual field that they practice isn't that interesting for you. And so I think you want to find a field where you enjoy studying and reading about it, and where you like the bread and butter. Like, you have to like the everyday. The cool stuff is always the cool stuff, right? You do this crazy case that you haven't, people see once in their career, right. But that's not what you're doing every day. And so you have to decide if you like the everyday kind of monotony of the types of patients that you see, the type of work that you do. Do you like reading about it? Do you like learning about it? So those are things I always tell people to pay attention to on their rotations. Is like, what do you go home and enjoy reading about? And what kinds of patients do you like talking to?
So how does one who's interested in urology make themselves competitive for matching into urology in residency? And you're obviously qualified to speak to the program director.
Yeah, I mean, urology has become very competitive. So, it is definitely one of the more competitive subspecialties. And so I always tell students kind of early on, so the things in your first and second year, students should start looking for research. And if you're thinking about urology, it's great to do urology research, but it doesn't have to be urology research. It could be any research project. And I think as we've moved, the applications have changed a lot from when I was an applicant. Step scores are becoming pass-fail, grades are becoming pass-fail. So there's less objective data for residency programs to look at. Right. And so the things that we look at are obviously that you did well on your rotations, but then things that help us distinguish are, academic work. So we look at people's body of research. We also give a lot of weight to the letters of recommendation that speak to your character, speak to how you did on your clinical rotations. And that information is really important. And then for urology, I think the sub-internship time period is also a very important part of the application process, because, essentially it's a month-long interview. Right. And it allows us to see how you performed. And so the letters from those rotations are a very big part of the application.
So you mentioned seeking out research. How do medical students seek out research as, once they're in medical school and they have to focus on doing their classes and, not failing their tests?
Yeah, so especially I think between first and second year, there's usually a break. And during that time is a good time to do some research. What I encourage students to do is to maybe pick an area where they're interested, reach out to that department. Sometimes the easiest person to start with is like a program director or other people that are listed. Most medical schools have faculty listed as advisors for a specialty, so you can reach out to those people and ask to meet with them and ask to get connected with resources. And then as a medical student, I think you want to find research projects that are contained.
Right.
So, sometimes it's really hard to find a project or join a project that is just getting started or might take several years because you're only there for a short amount of time. So ideally, you try to find something that maybe is going to need some intensive chart review over your summer break, and that's a good time to do it. Maybe you get involved in like a review article type of project because that doesn't require patient data, you're just reviewing literature. So those are sometimes some easier projects to try to do. And I think to try to be realistic about what you can accomplish. You don't want to take on doing a randomized control trial. Like that's just not going to happen, right? But if you pick something finite, like, hey, I'm going to look at, this specific problem, I'm going to do a retrospective case review. Okay, like that's something you can maybe pull off during your time as a medical student. And then I think the other thing is a lot of students are taking some time off to do research. If you are somebody who is looking at a very competitive specialty, maybe your application might not have everything that you need, then maybe doing some research time is of benefit.
Like an additional year.
Yeah,
right.
like an additional year.
Yeah.
Or, a gap year before medical school. Yeah.
In terms of being successful as an attending, do you think that there's any soft skills that you need to pick up in medical school and residency that aren't explicitly taught, like a hidden curriculum?
Oh, definitely. I think I think a big part of being a doctor is making your patients feel comfortable with you and making your patients feel like you're someone they can approach. So I think one of the reasons I really love what I do is because I primarily see female patients. I specialized in women's urology and reconstruction. And so probably 80% of my patients are women, and they come to me because they like seeing another woman. But, I get so many hugs in my clinic and, a lot of, oh, I've never been able to talk to somebody about this problem, and like you're understanding that. But, those soft skills are things like sitting down with the patient, looking them in the eye, looking like you're not trying to rush out of the room, like you're giving, even if your visit is short, making them feel like they're really listened to and that they're heard. Things like sometimes repeating back what you heard, like, is this what I'm hearing you saying, and then for surgery, I think a big part of what we do is deciding who to actually operate on.
Right.
Operating, I can teach most people how to operate, but making the decision of who should go to the operating room is probably one of the hardest things because it's a little easier if you have cancer and you say, okay, you have cancer and you have to remove it. But even that has its nuances. For what I do, it's a lot of quality of life surgery. You really have to understand what the patient's expectations are. Right. And is what you're going to do actually meet those expectations or make things worse, And so I have a lot of conversations with patients about their goals. And so I think having those conversations, you have to have the soft skills to be able to kind of navigate a patient through that conversation.
That makes sense. So back to your journey. So you were in medical school and then comes residency. What was urology residency like?
Yeah, so it was a 5-year residency, and at the time that I applied or went through residency, there were more women in urology, but it was still we were still a pretty small minority. At that time, 3% of practicing urologists were women. Now it's 10%, so we're better. And now I would say most residencies are probably 30 or 40% female. At that time, that still wasn't the case. So it was an interesting experience. I think I loved my residency, but it was a hard 5 years, I think. But I knew that. I guess I knew going into it, I was going to have to work hard. I was going to work long hours. Like that's how you learn surgery because, if you're in the middle of a case, you're not going to leave at 5 o'clock because it's 5 o'clock. If the patient's still on the table, like you have to finish the case, right? So, I kind of went in knowing it was going to require me to really dedicate time. And so I think in residency, you kind of find your balance. I mean, it's work. And then I think you have time for maybe one other thing outside of it. And you have to just be okay with it during that time.
What are some of the additional challenges minorities face in specialties where they're obviously the minority?
I think you mentioned imposter syndrome earlier, and I think there is a lot of that feeling of imposter syndrome, of feeling like, am I as good as everybody else? I think women oftentimes generally we're not taught to be as confident sometimes, especially in situations where we're the minority in the room. And so sometimes, I feel like there would be times where my male colleagues might walk into an operating room and just exude a confidence that maybe I know I was just as qualified, but I might not come across in the same way. So then I had to sort of prove myself. It's interesting too, there's I think a lot of implicit bias in the healthcare system, and there's also a lot of hierarchy, especially in surgery. And so when you come in as a young female resident, you have to prove yourself to the OR staff, you have to prove yourself to the nursing staff, and sometimes you have to do it, it's harder. And that those things were a little bit more challenging. But I think the thing I learned was I had to be confident in how I came across, and I just had to figure out my own way, because sometimes the way other people did things didn't work for me.
Right.
And I had to feel like I could find my way in that environment, but in a way that was authentic to who I am as a person.
Mm-hmm. So what exactly makes residency so challenging? Because everyone knows that becoming a doctor is hard, but like what goes into why? It's like, people get stressed out, people work long hours. Obviously burnout is a huge thing. Like what goes into that?
Yeah, I think it's a lot of things. So one, I think it's a lot of hours, obviously. So there's just a sheer number of hours and the sheer amount of information you're trying to learn. So that's like the initial part of it. I think it's physically demanding, especially a surgical residency. You're on your feet. You don't drink as much water. You don't eat as much food at regular times during the day. So you kind of have to train your body to be okay with that. So that's physically can be taxing. I think the other thing, though, from the other side of it is that you're trying to acquire a very high level skill set. And it's a skill set that carries a lot of responsibility, and you have a finite time to do that. And so you're trying to get as much exposure, as many reps as you can, right? And so it's just that constant kind of like, I need to learn this, I need to learn this. And so that can be exhausting, right? And then I think it's also hard because your family and friends, for most people, don't really understand what that experience is. It's a very intense experience, and if you haven't gone through it, it's very hard to explain to other people what this world feels like. And so it can feel very isolating. I think also it's harder to attend family events. It's harder to be at a wedding for the whole week. You can maybe only go for a couple days. So there's a lot of life that happens outside residency that it can be hard to engage in the same way that you would if you were not in sort of this intensive experience. And so I think those are the things that contribute to burnout, because you just have less time for all of that,
In terms of like the positive sides of residency, what are sort of the unique things that you gain as being a resident that you kind of lose when you become an attending?
So I think the camaraderie you have with your co-residents is such a special experience. Actually, I think we're lucky here because we have that amongst our attending group as well. But the time you spend together as co-residents is really special. I mean, again, as I mentioned, you're going through this intense experience, but you're going through it with other people. And hopefully you like at least some of those other people. And I think if you talk to most residents, they really bond with their co-residents because you have that experience. And usually their significant others and families bond too, because you kind of, again, you all go through this together. I think also it is sort of a special time because you don't have that personal responsibility of the patients. Like, you don't have the outcomes of the patients. You take care of someone, you go on to your next rotation. You don't see them again. Once you're an attending, that patient is yours and you will see them again. And if there were problems, like, you will see those problems again. As a resident, you're kind of sheltered from that. So it's this kind of amazing time in that you really get to learn your craft. And I think that spirit of learning and skill acquisition is just a really special thing during residency. And I also think that you gain, I think you learn a lot about yourself as a person during that time. Like, you learn what kind of person you are. You learn how to really prioritize things, both personally and professionally. And for a lot of residents, I think a lot of life happens during residency. I mean, you're in your 20s. Most people are in their 20s, maybe early 30s. People are getting married. They're having kids. They're having sort of big life events happen too. And so it's kind of that's also a really special time.
And so after residency, did you do additional fellowship training, or did you jump right into it?
Yeah, so I did a 2-year fellowship in female urology and reconstruction.
Mm-hmm. And so what made you want to take on that additional training versus jumping into being an attending?
Yeah, I think particularly in my field, we get exposure as residents, but we don't really deep dive into a lot of what I do. And so I felt like if I really wanted to do this, and part of why I went to urology was to take care of women, and if I really wanted to be the best doctor for my female patients, then I felt like I needed to spend a couple years training in that and really spend that 2 years learning all the surgeries, because I wanted to be able to offer everything to my patients, and I didn't feel like I could do that from just my residency. So I did that. And then the other reason too is I was considering academics at the time. And in my specialty, I think to be in academics, you really do have to be a subspecialist. And so that was the other reason to do the 2 years, is then I would have the accredited fellowship training, to join an academic department.
So in terms of your subspecialty in urology, how does that differ from like OB-GYN, where you also get to take care of women, but it's a slightly different organ system?
Yeah, so I think it's a little bit different in that, so you can get to some of what I do. So I do a lot of, I treat pelvic organ prolapse and incontinence, pelvic pain, sort of voiding dysfunction. You can also do some of that if you go through the gynecology side and do a urogynecology fellowship. So there's sort of 2 ways to get at it. I think the big difference, though, from urology is I did do a 5-year urology residency. So I still take care of men. I take care of men with spinal cord injury, neurogenic bladders, other voiding problems. I still, when I'm on call, I still take general urology calls. So I still do kidney stones and bladder tumors and, difficult catheters. And if you go from the OB side, you wouldn't take care of any men. And you also wouldn't do a lot of that other general urology, but you might do more general gynecology things.
So what is the spread of diseases that you treat as a urologist? Are they urgent? Are they life-threatening? Is it sort of more preventative? How do you, what does the case look like?
Yeah, so my specialty, most of what I do is quality of life. So I treat incontinence and prolapse, and these are more quality of life conditions. They're not life-threatening. But within urology, we do treat life-threatening conditions. So when I'm on call, for example, I was on call this weekend, and if someone comes in with a kidney stone and an infection, that can be life-threatening. You can get septic shock from that if it's not stented. So like on call, we'll place a ureteral stent up into the kidney, and that immediately sort of drains the kidney and can help prevent that person from getting very sick. We take care of a lot of GU problems, so testicular torsion's an emergency. We get called if someone can't pee and they're in severe urinary retention and someone can't place a catheter. That would be where a urologist would come in to help. We also take care of cancers of the urologic tract, so bladder tumors, kidney tumors, prostate cancer. And then we also have a pediatric subspecialty. So, we take care of kids that are born with genital anomalies. Kids get kidney stones too, so there's a lot of sort of developmental pediatric things that we take care of. So it's really kind of a nice specialty in that I think we have a huge breadth of what we do. We do small 5-10 minute cases. We do a lot of endoscopy and use a lot of fun tools. We do open surgery, vaginal surgery, open abdominal surgery, and then we do robotic surgery, which is great too. So you really get kind of this whole breadth and spectrum of procedures and patients,
So what does your day-to-day life look like as a surgeon? Like, what does your week look like in terms of splitting between, research time, teaching, practicing?
Yeah, so, I'm here at University of Michigan, so I'm in an academic position. I also am, as you mentioned, I'm the residency program director. So my average week, I do 2 full days of clinic a week. So in those clinics, I might see anywhere from 22 to 28 patients in a clinic. My clinics are usually pretty heavy with procedures too. So I'll see patients, but I also do a lot of office cystoscopy. I do Botox in the bladder. I do some other kind of clinic procedures. So it's nice. There's a nice flow of seeing patients, but also doing procedures. And then I operate about a day and a half a week. So, those days I'll do vaginal cases, I do some neuromodulation, some cases in the spine, I do some cystoscopy or endoscopy cases, and, probably once a month I do a robotic case or so. So kind of a nice mix of some larger cases and some smaller cases. And then that other day and a half a week, I spend doing administrative things and research. So I'm supposed to have about a day dedicated to dealing with residency things. So I have 23 residents that I take care of. And so I have administrative responsibilities, keeping the program running, reviewing the residents, helping residents that might be struggling, doing different programming for our residents. And then I have some research that I'm working on, and so I have some time for research projects as well.
What is your research in?
Yeah, so I am doing research in the area of neuromodulation, and so it's been really great being at Michigan. I partner with one of the biomedical engineering labs on campus, and so my co-investigator, he's a PhD in biomedical engineering, and his lab focuses on neuromodulation too, and they have a rat model and a cat model that they use, and sometimes they also use a sheep model. And so we've been doing some work looking at how to use different nerve targets to improve bladder function, and we've been looking at, there's a device we use in urology, and so we've been looking at how that device works and kind of looking at the end organ response, and we're trying to see ways that we can better understand it so maybe we can improve how we use that device. We've also done some work in female sexual dysfunction and looking at nerve targets for that. So it's been kind of a really fun collaboration. I get to work with a lot of undergrad and PhD students on the engineering side, which is really fun. So,
do you ever see the clinic pouring into the research, or the research going directly into the clinic?
Totally. A lot of the work we're doing right now is on the patients that I operate on, and we're studying those patients. And then we're also doing some work looking at kind of new ways of treating some of the conditions that I work on. So that's also really interesting, because I think research works best when you think about doing a project that's going to help your patients. And so that's really the work that we're doing. I think will hopefully be things that will help my patients in the future.
Excellent. So, as the urology residency program director, why should someone pick urology?
Yeah, because it's the best. I think, there's a few things, right? So I think urologists generally, if you talk to most people, we're a pretty happy group of surgeons. And, students always say, like, you should look at kind of the field. Do you like most of the people that you meet? Do people seem like they're happy with what they do? And if you meet most urologists, usually people are pretty friendly. They're usually in a pretty good mood. And I think it's because most of us, if you ask us, really enjoy what we do. We have a nice practice in that we get to see patients in clinic. We get to build longitudinal relationships. We do a lot of clinic management, but then we also operate on people and, make them better. I think there's a high level of satisfaction in some of those situations I described, like someone comes in, they have a kidney stone, you go treat it, they feel better, right? Like that feels good. Right. So I think there's that part that's really fun. I think the other thing that's really nice is I think urologists generally have always been really interested in technology and have always been at the forefront of how can we use new technology. And so for people who like that kind of exploration, urologists were the first to really adopt the robot, right? Mm-hmm. And so I think people like exploring and saying, like, how could we do this better? How could we do this differently? And so I enjoy that. I think it's like a nice environment to be around people who are curious and interested and enjoy what they do. And I think that we also we treat great patients. I mean, the conditions that we treat, like, people don't like to talk about them, right? Yeah. No one wants to talk about leaking urine. People don't like to talk about their erections. Like, those are things that are, they're embarrassing and they're taboo for people. But when you help patients with those conditions, like, the level of satisfaction that they have is really incredible. And to have someone tell you, like, I haven't left my house because I'm embarrassed about having an accident. And then they tell you, I got to go to a play with my friends, and I went out to the grocery store and I wasn't embarrassed. I mean, that is really impactful. So
interesting. If you could give one piece of advice to a pre-med student who wants to get into medical school, become a doctor, potentially become a urologist, what would you give them?
I think I would say to do things that you're passionate about. I think we're all, when you're trying to get into medical school, you're thinking about your CV and like how to make it, be competitive. But I think the best way to do that is to also do things that you enjoy doing, because you'll be successful because you enjoy them. And then when you put them on your CV and people ask you about them, you'll be able to talk about them with enthusiasm and excitement. And I think that really comes through when an applicant is excited about something. That always allows you to see someone in a very positive light.
Excellent. Well, Dr. Gupta, thank you so much for your time. It was great
Of
having you.
course. Yeah, thank you.